call the Portage County Diversity Affairs and Inclusiveness Committee to order. We do have a quorum, all members are present, and start off with the public notice. Members of the public who wish to address the committee on specific agenda items must register the request at this time, with such comments subject to the reasonable control of the committee chair as set forth in Robert's Rules of Order. First item on the agenda is the approval of the minutes from July. We'll do these one at a time, just for formality's sake. Is there a motion to approve the minutes from July 2022?
Also moved.
Second.
Second motion and a second. Any discussion? Corrections, additions? Hearing none, all those in favor with aye.
Aye.
All those opposed with nay. Motion passes. Approval of August 2022 minutes, the last meeting. Is there a motion to approve?
Motion to approve.
Motion by Campos.
Second.
And second by Rockman. Any additions, subtractions, corrections? Hearing none, all those in favor with aye.
Aye.
All those opposed with nay. Motion passes. No reports this time around. Lots of correspondence. I will thank Trina for sending me a lot of really great information just to kind of set some foundational information for folks about mental health awareness and people of color and kind of mental health awareness and numbers for the nation in general. I'm trusting all of you read every last 91 pages of this. I apologize, it was all very long. There was a couple book pages, unimportant pages in there, it's just photos and stuff. So there is the Midway Life Report PDF file, just kind of their four major steps for action. I included that. I included the WCA DEI regional meetings agenda and PowerPoint that I attended just a couple weeks ago. BIPOC MHM toolkit, LGBTQ plus mental health, and then what I described before, the mental health in America. Did anybody have any questions, comments, or concerns about the reading, just the educational component?
I had an opportunity to go through all of that.
Yeah, it's there for your reference, right? It's not, it will help, us to have a good dialogue today, so that's why I like to include these things. And I realized that if I could get the agenda out a little bit sooner, we would have had more time to digest and read this, so I apologize for that. All right, maybe we'll move on to item number 7, discussion possible action regarding special meetings attendance. Are there any requests for special meetings attendance? No. Approval of attendance special meeting sheets. I did go to the WCA regional meeting up in Wausau. So I was there as well, and Chair Hager was there, and
HR was there and checked.
yeah. So we have a strong presence from Portage County of people interested in this work and the work that WCA is doing. Did you either of you get to go to Appleton?
No, I had one conflict.
No worries. A great event. I had a couple workshops with Marcelia Nicholson and Troy before. I can't remember Troy's full name. He is the county executive from Brown County. They presented at WCA last year, and that was kind of their, hey, we're doing this work for counties. What do y'all think of it? Well, I had another workshop with Marcelia through the Local Government Leadership Academy, and she talked just about being a woman of color in leadership, not necessarily about DEI initiatives that they presented. And then they are kind of midway, kind of finishing up their work through the counties and doing tours around the state about this work. And they're gathering information on how the workshop's going. and how they can do it better. So we'll talk about that at the WCA meeting. So if any of the supervisors here want to attend that, it's a great conversation. They have an approach that is obviously a little different than Portage County.
This is Brown County.
Yeah, so Troy is from Brown County, so they have a significant population center there, but they're rural-ish, right? They have Green Bay, significant population center, a large Black population, Hispanic, Hmong population. So they are really pushing forward efforts in the community to evaluate their programming and their services and whether or not they're serving the needs of the community. So they're doing a deep dive into that work, and they've put forth a number of initiatives as they get the data and the numbers. Marcella Nicholson, on the other hand, is the county board chairwoman for Milwaukee County. Very different county from Portage County and Brown County. I believe she said 70% of the population in Milwaukee County is Black. So they have done a real deep dive into their policies and protocols through county government, and are looking at evaluating kind of their methods of deployment in terms of that. My question for the entire room was, how do you take your strategies and hone them for rural Wisconsin, right? So we live in Stevens Point. It's a population center. We have, obviously more communities of color or marginalized communities than, say, Elm or Amherst or Bancroft or the surrounding communities. So how do we hone that to fit all the needs of rural Portage County, because we're considered a rural county, and that's the majority of our state, right? So I think we're going to work on that. I'm actually going to be one of their regional contacts for counties in the northern region and central region. So we're going to work on how we tune that messaging to our rural partners to make sure that we're getting the best services out there and also doing the appropriate work from a county level standpoint. So that's my report. Does anybody have any questions?
So you posed this question to the room while you were there. Did you get much in the way of responses from some of the people in the other counties about how you might implement any of these initiatives, like rural versus larger areas?
Yeah. I think that, as with the WCA meeting last year in La Crosse last fall, our boards of supervisors are very hesitant to dip their toe into these waters, right? They're unsure what this means. Like our own county board, we can't even say the word equity without someone getting offended, right? So a lot of county boards are looking at this work and they're approaching with a little trepidation, but there's always a few champions on their boards that are doing this work. What I learned is that this is still a learning moment for a lot of county board supervisors around the state, which is great. We have to meet people where they're at, right? We have to start somewhere. So I didn't get much. Perhaps you could help. What did you hear in terms of what other supervisors were thinking and doing, or how they felt about this topic?
I heard a lot of questions and I didn't hear a lot of answers.
Sure.
So I don't have anything to report on answers for that.
I think that's what I heard too. And it's literally like a lot of counties are putting their toes in the water so they can evaluate their services, look at it, and see if it's appropriate for them. So it's going to be an exploration and information and knowledge, and that's why we're starting here with our professionals today. So, yes.
Do you think? I mean, I'm curious because when I think about some of the things you said about issues with leaders not kind of wanting to talk about this or understanding or anything like that, I look at this from like our meeting or last time, and part of my question was like, I need to understand the county's issues in order for me to say that there's even a need first. So, which is part of the reason we talked in the first meeting and second meeting about let's bring in the police department, let's bring in the health department. Let's understand where the numbers are so we can understand where we need to focus. So I asked that to ask, do you think maybe that's some of the confusion is that no one sees the issues because they don't have appropriate experts coming in with a nonpartisan answer for people like, here's the statistics like from Portage County. They're not mangled. They're not fraud. This is it. Because I think that could be part of the reason why there's a lack of acceptance is because you can't see the data. Somebody needs to bring it to us, explain it to us, then we need to determine, okay, that's the data says that's an issue. Let's hammer that out. So again, I was just curious because it didn't sound like there were answers from anybody. I'm curious as to why. That's part of the reason, and I think it's relevant to our group because I want to get that data.
Yeah. I will say this is my opinion of what, it's kind of like what you're saying. People have a lot of questions and they do want firm, hard numbers about what the actual data says, right? So we can evaluate and look at it. So part of our discussion last meeting was to do just that. So as I'll introduce here in item 8, we have a series, a panel of professionals that work within the community and within our own county government that are here to bring you those numbers in. Like, hey, here's the paperwork, these are the hard cold numbers, and that's the data we have for Portage County today. So I think, in my opinion, is there's a lot of questions in those counties because there's nobody asking, not a lot of questions in those counties, questions from the county board supervisors because no one is really asking staff and professional folks, like, what are the actual numbers? Is this actually a thing? So it starts with a county willing to do it. So we're going to be one of those counties. Dane County has done it. Outagamie County has done some work. Brown County has done some work. Milwaukee County, Dane, a lot of counties with large population centers are actually doing this work, and then city councils have done this work as well. So it just takes a little bit of time for people to process that information. If there's no more questions for me, I'll entertain a motion to approve my special attendance sheet, which is buried somewhere in the back of the back of the.
They're right towards the back.
Yeah.
It's, right?
No, it's approved.
Yeah, we just asked for approval. You approved that I go to it now. I'm asking for approval, basically to accept my attendance.
Also move on.
Any discussion, questions? Hearing none, all those in favor with aye.
Aye.
All those opposed with nay. Hearing none, motion passes. Thank you, folks. Item number 8. So, discussion on the mental health, AODA, and family resources in Portage County. I really want to thank the 5 folks who came and joined us today. The original intention of this group was to talk about mental health in Portage County, substance abuse and AODA, counseling and discussion, homelessness, all the things, right? All the things that we are struggling as a society to deal with. So I made some phone calls and I realized, holy cow, this could just get out of hand. We could have a conversation for weeks, not just an hour tonight. So I honed this back to AODA and mental health. And I brought in Craig from Family Resources to kind of talk about how this is affecting our children. So tonight on our panel, we have Jessica Haight from Portage County Community Programs Manager right here. And we have Craig Sankey next to her. He's our Child and Family Services Manager. Michael Clements is right back over here. He's our Veteran Services Director. And Trina Bierman, she is from Mental Health Navigators and Suicide Prevention and Mental Health Awareness Coalition co-chair. And then Akira Zarazua, a former member of this committee, and also she came on the recommendation from Amy, who said, I can't make it. I didn't just talk to Akira. And I was like, of course I should talk to Akira. So Akira works at Gap Services Family Crisis Center. She's a shelter advocate and opportunity development center community mental health management. Thank you all very much for coming. We have, I guess the committee has some questions, but I kind of prepped you all on what we would like to discuss and talk about. I'm just wondering, who would like to go first? Who would like to talk about information that they have, data that they have, based on kind of mental health awareness, services provided, AODA counseling services, things like that here in Portage.
And I like to hear like the gaps, like what help do you need or how do you see this committee supporting?
Anybody? Any takers?
I can go first.
Sure.
Craig Sankey, Child and Family Services Manager at Health and Human Services. And what I'm going to give you a high level is when we deal with child abuse and neglect, the numbers of ethnicity and race that comes into our department. Give you a brief overview first of all. We don't control who comes into our department. That comes from referrals from law enforcement, from education, from parents, from concerned family members and community members. So we don't get to filter who comes into our department, our agency, so we don't get to say yay or nay. So a phone call comes in with some concerns about abuse and neglect of a child, and that is based on their concerns. So what it is, I pulled some numbers of our population of Portage County and comparable counties, Wapaka and Wood County, and the races as part of percentage of our population. I also pulled the numbers from our tracking system, our internal state tracking system from the state of when we get the numbers. And that's why I have a real high level overview of it, okay? So for the estimates of the population in Portage County, Wood, and Wapaka through July 2021 from the Census Bureau website, Portage County's population is 70,468 compared to Wood County, which is 74,070. Wapaka County is 51,000. The population of people under 5 years old, which is a good number of population that we deal with, and Portage County is 4.7%. And the population of Wood County is 5.5%. Wapaka County is 5%. And the population of those under 18, so that encapsulates everyone that we work with. We work with anyone from birth to 18 years old. So this number encapsulates everyone. It's 19% of Portage County, 21% in Wood, and 20.3% in Wapaka County. Now, population by race per the Census Bureau website. In Portage County, white is 93.5, Wapaka 94.6, excuse me, Wood is 94.6, Wapaka is 96.7. Black African American is 1% of both Wood and Portage County and 0.6 in Wapaka County. American Indian and Alaska Native are 0.5% in Portage County, 0.9% in Wood, and 0.8 in Wapaka. The Asian population in Portage County is 3.3%, Wood County is 2.1%, and Wapaka is 0.6%. Hispanic or Latino in Portage County is 3.8%, Wood County is 3.6%, and Wapaka is 3.5%. Now, when we talk about the cases that we deal with, in Portage County, cases that we deal with for population by race, we deal with 73.63% in 2021, which was approximately 315 cases. Now, for African American or Black, we had 5.24, which is 28 cases. Proportionally for Wood County, they're at 7.66%, and Wapaka is at 3.36%. I didn't compare Marathon County because that's a really big county compared to us, but they more than double our number of Black and African American children that are in their system. So comparatively speaking, for us per Marathon County, we're doing okay. Again, we get the reports and we don't get to choose what cases come to us. We get them, we investigate them, we move on if they need servicing that. Indian and Alaska Native in Portage County is 3.24%, which was 16 cases. In Wood County was 2.9%, 2.21 and Wapaka's 1.30. I didn't get the cases for the other counties. I just didn't get that deep into the dive of the numbers. In Portage County was 3.41%, which is 16 cases. Reminder, when I talk about cases, they could be duplicate cases. Some families have multiple referrals that come in, right? So when we talk about, let's just say the Asian of 16 cases, we could have 3 referrals at one family. So it's not families, that's referrals that comes in. So we talk about, African American of 28 cases. That could be repeater cases potentially. We could have the same situation reported by 2 different people. Okay. Hispanic or Latino, 7.32% of 40 cases. In Portage County, and Wood County is 3.93. Wapaka is 2.59. The numbers I have on a real high level. I didn't want to get, like Vinny said, we could dive real deep into this and go down, for lack of a better term, a rabbit hole and be here for a long time talking about it. But from our department's standpoint, from my standpoint, we do a real good job of comparatively speaking, of dealing with the people that we have, and it's not disproportionate to other counties in the race that we have. We deal with what's in front of us. We don't look at race or ethnicity. We deal with the situation that's in front of us. And I hope that's reflected in the numbers and continues to be reflected, because that's how it should be done. So any questions on the numbers I have? I know they're real high level, not real in depth, but I just want to give you an idea of, per county, and talking of comparative counties between Wood and Wapaka County. I looked at Brown County again, but he talked about it's not comparative. So I just did the surrounding counties, and I didn't want to come up north and got more rural, but I just think that's a bad idea as well. So I stayed central Wisconsin located. Yes, ma'am.
Correct. So you mentioned 315 referrals.
Yep.
Last year.
Correct.
And some of those then can be duplicates.
Could be.
That might not be, okay.
Correct. And again, I probably could have dove really deep to figure out how many. To be transparent, I didn't have the time to do that. But we could probably figure that out if need be. But what that number is, I don't know. So.
Are these numbers at all significantly different than prior to COVID at all?
With COVID?
Prior to, like these numbers now compared?
I did not look. I can look prior to COVID to see what those numbers would be. I don't know. Respectively speaking, when COVID, our numbers did drop because, one, children were not in schools. Most of our referrals come from schools because the teachers are seeing the children on a regular basis and seeing the concerns, seeing the potential neglect, seeing the potential abuse. They're also not necessarily seeing their therapists, mental health counselors in person, as all telehealth. So, I would say drop off, but there were still some concerns because the children and the families were cooped up, right, not getting out. But so I don't know the answer to prior to COVID. That's something we can look at if we needed to. The numbers are there annually as to where they're at.
Thank you, Craig. Does anybody else have any other?
Another question for Craig.
Absolutely.
Craig, when you talk about the teachers being the primary source of referral, are you able to do outreach into the school systems to help people identify the possibility of abuse or the reason for a referral?
Absolutely. We do not only to teachers in educational settings, we do to therapists. We do what's called a mandated reporter training. We don't necessarily do that annually, but we do it in the schools to because there's turnover, unfortunately, in each field. But we do mandated reporter trainings to educate those professionals to know what to look for when they need to report abuse or neglect. So, yes, we do that on a regular basis. And honestly, I got a call not too long ago from Delta Dental because they're providers, like dentists, do see children as well. So they want to know what their clients may be seeing, as far as abuse and neglect from dentists. So we're working with our community partners, not only schools and therapists, but doctors and physicians and dentists as well.
Any other questions? I'm hoping once we get everyone speak just a little, there just can be a creative flow and dialogue between all the different professionals in the room with us too. So, Jessica, would you mind going next?
Sure.
Thank you very much.
So I'm the community programs manager, which is a lot of things, but Part of it is I oversee the mental health clinic at Health and Human Services. So I have those numbers available. I oversee AODA programming at the county level. The only thing we do with AODA is we provide OWI assessments that are court ordered when people are convicted of OWI related offenses. I'm sorry. Okay. So, yes.
I saw the number.
Okay. What you're saying is so important.
Yes. Okay. So
Okay.
I oversee the mental health clinic at Health and Human Services. So that's our 2 psychiatrists and our 1 psychotherapist and our intensive in-home therapy program. We also see AODA. We only provide OWI assessments, which are court-ordered assessments that people have to do. We might refer people out to AODA treatment as a result of an OWI assessment, but that would be to a community resource for a provider that's already established in the community, not through our agency. I also oversee the crisis program, so emergency mental health services. So that's the data that I have to report to you today. We actually have to report this data to the state on a regular basis on how it falls in terms of race, ethnicity, and gender. So the most recent data that I have, I can say from an AODA standpoint, basically the way that they do it is very similar to the way Craig did it. We put in the most recent census data, and then we put the population that we served. And then any discrepancy that's either overrepresented by 2% or underrepresented by 2%, we have to tell the state why we think that is. And if there's a disparity that's more than 5%, we have to give them a little bit more information as to why we think that is. So from an AOTA program standpoint, in 2021, the population of Caucasian people was underrepresented by 3.7%. So again, it's not a huge discrepancy, but it's one that I still have to say to the state why we might think that that is. Our total number of non-white race was overrepresented by 5%. Our number of people with disabilities was also underrepresented by 10%. So from that standpoint, basically what we're looking at is that part, since we only do OWI assessments and people are court ordered, kind of like from Craig's standpoint, we don't say who we're going to serve. They're sent to us from the court system as a result of the legal charge. So that's basically our explanation, is we don't have any say over what kind of population comes through on an OWI assessment. So they don't ask a lot of questions related to that, since we would be able to say why we feel that that's either under or overrepresented. From a mental health programming standpoint, we have, we actually have African Americans are overrepresented because they are at 2.3% greater than their population for what we were expecting to see. Asians are underrepresented by 2%, and then more than one race is also overrepresented. So that just means that there's more people that identify as more than one race or as African American that choose to come to our service and get services through the county. In terms of males are underrepresented by almost 9%. This tracks very much similar to neighboring counties, looking at Wood County and Waupaca County as well. I can't compare us to Marathon County because Marathon County provides their AODA and mental health services all through North Central. That also serves Langlade and Lincoln County. So all the reporting that they do to the state includes all 3 counties. So it's too hard to disseminate what their numbers truly are. So basically from that standpoint, really the one that stands out the most would be males that are underrepresented in the mental health clinic. And that's something that we really try to focus on, and just is that related to the stigma of reaching out for services and asking for help. So that's something that's just more that outreach, that, letting them know, and that education that the services are there. So that's basically where we're at with those numbers. And then for crisis, and again, crisis, emergency mental health services, that's typically law enforcement calling us. In most situations, it's law enforcement calling us. Some people will call themselves to the crisis line as well. And that is also, males are slightly misrepresented. They're underrepresented by 3.4%. So not as much as it is from the mental health clinic standpoint, but still somewhat underrepresented. And then so are the Hispanic and Latino populations. They're underrepresented by 2.3%, but this is also very similar to our neighboring counties. So again, that's just more education and outreach of we're here, utilize our services. From that perspective, the only other thing I can report when comparing us to Wood County or Waupaca County, the big discrepancy that I see between us where we do a little bit better job is we are representing our Asian community a little bit better than Wood County is, just by up 2%, but still it's there. And then Waupaca County actually overrepresents their men within their clinic program by 18%. So they have far more men that are utilizing their mental health services than we do. So that was one of the other glaring things that I saw. So they're doing something right in terms of reaching out to those men. That's all. God, goodness, you guys have questions.
Yeah, any other questions from the committee?
Hey, thank you for coming. I guess I'm curious in both cases, and maybe you can speak to this as well, like, and seeing some of these numbers, how they stack up with like neighboring counties, but is there a way you can, at least for reference, tell me like how they stack up nationwide, or would that be kind of irrelevant to look at? I mean, I know that's a really broad swath of the thing to ask for, but does this seem to fall in line with anything, across the country as a trend?
That could be something we could gather, but not unless Trina already's got it. Trina's got
I sent you the data from Mental Health America.
Yes.
Right. I don't have it in front of me.
these specific numbers we could compare to Wisconsin. We have to pull the numbers and basically to calculate other counties for this, I had to go on theirs and pull up their census data and then see what they reported to the state in these categories. So it took me a little time to do the math, but it's something we could do the same thing at the state level to see fully what's being reported to the state versus our state census and then compare the province.
That would really be comparative data though, right? Which is why you, right, yeah, so.
Because you look at different areas have different resources
Right,
available.
right.
And even looking at it from a county perspective, Wood County does provide internal AODA treatment services because that's something that people are referred to their county for outpatient treatment all the time, where we don't have an outpatient clinic at our county. So even comparing similar counties, that data can be harder to say they're apples to apples.
So the further out you broaden that scope, then like the more nebulous some of that data becomes, because now you're talking about comparing just large different regions that have vastly different services available. All right.
And population.
And population.
And some of the information that Trina sent over is actually in the packet I was reading, actually just before I got here. And it does give you that very high level view of kind of national the high level national statistics, right? Which again, as we're saying, it doesn't necessarily, it's not a very good comparison because we have multiple different services in neighboring counties, let alone what they're doing in California or Florida, wherever, in New Hampshire.
And you have to remember, this data does not include private clinics. This is truly only the ones that we touch at the county level. Private clinics don't have to report to the state like we do.
And am I correct in saying that the county level services are primarily for people who are lower income in life?
We don't turn people away. It's all, people just pay based on their ability to pay. But if they cannot pay, we do not charge for our services.
So it reaches another conversation of what does poverty look like here in central Wisconsin as well? Poverty of services, even just because we may not have what neighboring counties have or whatnot.
Yeah, just take us closer to kind of what I was looking to find out is how much of this is demographics, how much of it is sociological, and how do you kind of begin to delineate this so that people are looking at the data when doing assessments.
That is the toughest part about being a committee member of the county board, right? Finding really good data that's actually comparative and trying to make good decisions for your community.
Just to answer your question a little bit from the Child Protective Services, each state has their own set of standards and guidelines that they have. So Wisconsin's would be different than Minnesota's. So there may be a little bit different numbers because of their statutory guidelines and what they may consider abuse or neglect. So those numbers may be a little bit off because I don't know, I haven't looked at those. To be quite frank, I work here, so that's what I'm concerned about. But if we get a deeper dive, then maybe we can look at that. But and in each county, each is so different as to we talked about programs and services that are offered. I worked in this is my third county I've worked in. Each county is so different of how they approach things and the service that we have. The prevention aspect versus the intervention aspect. So it's just the philosophy at each different county and how those programs may affect this child protective service numbers. That may be a factor, right? The service that we have may play a part of those cases that may not become duplicate number of cases because we inundate them with services and address the issues where some counties may not, and they may have multiple times coming into the system, so to speak. Factors.
Yeah, well, exactly, and I guess that's where I'm getting tripped up because I'm still kind of learning all this. Is, when you talk about a lot of the prevailing philosophies and ideologies behind this kind of work, most of them have a sort of very top-down nationalistic sort of view. But again, the ideological purity doesn't work in every single case. Like if you consider Portage County a microcosm of the United States, well, that doesn't apply. Right, it was the point I guess I'm just starting to understand, so thanks for clarifying.
Can I ask to clarify? Jessica, did you say Portage County does not have outpatient AODA services?
Correct. We only provide OWI assessments, so we are certified as a prevention program, not a treatment program.
So where do people go for treatment?
A lot of people go through Ascension. Ascension is a big program here, so Ascension Behavioral Health is a big one. There are a lot of private clinics that you can go to that have substance abuse treatment.
And do people who are of lower income qualify for those services?
Those places accept Medicaid, yes.
And so most of the people that we're talking about here would be able to access those services because they would be on Medicaid?
Right, yes. Long ago, prior to my time at the county, we provided AODA treatment services, but because it was so vast within the community that it was a duplicative service, and that was cut at one point in time.
Okay, thank you.
Was there a case in which somebody wouldn't be able to receive those services?
No, because if somebody was, say, ineligible for Medicaid for some reason, but also not able to pay for treatment services, then we have grant money that we can use to pay that private provider to provide the service. So these providers know that we have certain grant dollars that we can use for treatment, and then they would just reach out to see if they could get grant dollars to provide treatment to that individual.
Is that a protocol everybody in this industry is aware of? Like if they come there, they don't qualify, they're like, hey, you've got this other option.
Go to the county, yeah.
And are those funds used heavily?
They were used a lot more heavily for residential treatment, but residential treatment is now covered by Medicaid. The treatment services. The big problem is that the room and board that comes with the residential is not covered by Medicaid. And it cannot be covered by our grant dollars because our grant dollars cannot supplement Medicaid. So then people have to come up with that payment on their own.
And that's one of the most costly of payments too. I mean, as we see in the healthcare center industry or.
The room and board. So say at like Ascension Las Vegas Behavioral Health, it is $32 a day that they have to. 32. Mm-hmm. They are a lower end facility. There are some facilities in the state that it's upwards to $86 per day.
You kind of said something that kind of piqued my ears. So please correct me if I'm wrong. You said we're underrepresented in the white population for AODA.
Yes.
Underrepresented in people of color.
We're overrepresented.
Sorry,
Of non-white. So basically we have to calculate African American, American Indian, Asian, Native Hawaiian or Pacific Islander, other, or people that identify as more than one race. And then they take all of our percentages for that and then put that in one category to see if those populations as a whole are also either under or overrepresented. And individually, we're not over or under in any category, but as a whole, we are over.
So And you said you have to report maybe a reason why it is that way. And then I heard you say something as potentially it could be referrals from the court.
This is all court ordered, so yeah, so we have no say over who gets court ordered to an OWI assessment. Everybody that gets convicted of an OWI has to do one, but we would have no say over, like, we have no way of saying, let's try to reach out to increase or decrease that population. That is all related to charges that people receive related to OWI, and then the court orders they received to come to us for the service.
So that kind of brings up my concern is that we're overrepresented in people of color receiving OWI referrals, yet 93% of our population in Portage County is white. And we're
Right.
underrepresented in the white population in OWI state.
Correct.
I've been downtown on a Saturday night, and I can, everybody down there is drinking, and there's it's kind of a similar demographic in terms of people of color versus our white population. So this isn't obvious.
These are just the people that are complying with the court order, right? There are people that don't necessarily comply with their court order for the assessment. So it's if you wanted to look at that, you'd probably have to look truly at the number of people convicted of OWI or charged with it, depending on what you're looking at.
So that might be an interesting thing for us to talk about when we talk to courts and sheriff and police department at the time. Like, hey, look at these numbers. What is this?
And it
true?
could be related to cost, right? This OWI assessment costs $250. Is that a financial hardship? We cannot help people pay for that because it's court ordered. So within state statute, it says there's no financial assistance we can give people to help them pay for this assessment. This is something they have to come up with on their own. We haven't adjusted the fee. We've kept it at $250 for a very long time. There is a number of counties that have increased it, but we've kept it the same. We try to make it so that it's less of a hardship and that people can schedule by just paying $100 up front, and then they can maybe schedule for a month out to give them time to come up with that remaining $150 prior to the assessment. But we can't actually help them pay for it. So is that adding to the factor? It could very well be, but.
Well, and additionally, there are plenty of private services that offer the AODA assessment, correct?
But
They
this,
don't all get funneled to the county, like,
Correct.
you just have to have one if you get convicted of almost any person in this county. So.
and this is, an OWI is separate. OWI assessment is separate from an AODA assessment.
Oh, but the point is, like, it's entirely possible that some of these discrepancies exist because they're just simply not going to the county for those assessments.
Yeah, I make no assumption that this is law enforcement or court's problem or creation of a problem. It's more of like, hey, let's look at their numbers too and see what they're experiencing and how do we evaluate our program. Right? It's just,
Yeah. To his point though, we are the only facility that can do an OWI assessment.
oh,
That's in state statute.
thank you. Does anybody else have any more questions for Jessica? All right, moving on between the two ladies in the front row, who would be most appropriate to go next? Because I know you're both in this, you're very much in this world, right?
I guess it's me.
It's you. Thank you for being here.
So I didn't bring data because you told me I was coming here for a conversation. Very clearly several times, so I ignored your email. So I work at the Family Crisis Center, which is on the agenda, but I'm not here representing that. I work at Opportunity Development Centers. I'm the community mental health manager. So our department is Comprehensive Community Services, which is community-based mental health support. We serve youth and adults with the goal of mental health recovery and preventing hospitalizations. I mean, we know all of these other things cost a lot more money to provide versus, using those kind of dollars to support people in their community, in their homes. So our services range from, meeting with people who maybe have a hard time just going in the community. So maybe we just meet with them talking about what it would be like to go out and, have a cup of coffee and helping them work towards that independence. So we're always working towards people being fully integrated in their community and whatever that looks like for them. So all of our consumers come from, they all have a plan that we're working off of what those goals are specifically to serve them. The services we provide, individual skill development, we provide employment services, but always related to the mental health or AOD. So our agency does serve Portage County, Wood County, and Marathon County. So a little broader reach in what we're doing. Like I said, we have youth and adults. I feel like these numbers that they're talking about funnel over to us because
I have CCS numbers because I am the administrative oversight of the CCS program at Portage County. I did pull those just real quick too, if anybody is interested in that right now too.
I can take the bus off of me.
So that's just the basics of our program. I guess in talking about specifically like what are the gaps, I'm not sure what specifically this committee can help with, but I can say that our biggest thing is we jump to like mental health. People need help with mental health, but we also have this missing area of basic needs that aren't being addressed for people. So housing and transportation and like just those two things by themselves, huge. If you don't have a place to live, you really can't work on your mental health that's out of control because you don't have a place to live. You have no solid foundation to build on those other things. So it's hard because I know we talk a lot about there's not enough providers and all of that. Yes, we could always use more mental health providers, but the providers that are here to provide the support are just seeing that this is what's missing, is the housing, affordable housing for people. People just we have programs here to help people pay for housing, and yet people can't get housing. It's heartbreaking. Like, this is what I deal with every day. And then transportation, it's such a basic thing, but like for people, when we're talking about countywide, like there's not a good way to get from Almond to a job unless your job's in Almond, right? And so you're limiting where people can work and what their skill levels are and all of that. If we can't find better ways to transport people throughout the communities that they live and work in. So
That's an incredible point, and those are going to be some topics that we're going to touch on as well, housing specifically.
Sarah, could you describe a little bit more about the housing difficulties that you run into? Are you talking about single people, families?
yes, everyone who is low income, especially. I mean, people who are not low income, who work full time, are still seeing the same struggles of trying to move at this point in time, like, because the changes in the housing market have impacted rentals. I mean, it's just a huge picture that I don't think anyone here has a solution to at this moment. But we talk about we have programs like Rent Ready that can help people get the experience and have some support behind them to get an apartment if they have a poor rental history or anything like that. But once they get through that program, they're finding there's not any apartments that people can afford. So,
And to let alone even furnish them, right? Like you might get an apartment that is over your cost, and then you have to try to find the things that go in an apartment so you can actually live. I've donated tons of stuff to that program. I could donate 10 more houses worth, for sure.
So you're saying, if I understood you, that adding more mental health providers is not an answer to some of these issues. It's having the resources in our community for people with mental health issues. Housing, transportation, big ones. That's very interesting.
Yeah, and I can speak to that from my program as well.
So I'm with the Mental Health Navigation Program at CAP Services, as well as the chair for the Prevent Suicide Coalition of Portage County. But what we do in mental health navigation is serve all Portage County residents who are struggling with a mental health issue. And what we do is assess what is your mental health need, your service need, whether it be a therapist, a psychiatrist, a support group, whatever that need might look like. If it's county-based, we will refer to the county. A lot of times it's private clinics. And then we also look at what are the life stressors that people are dealing with. Do you have adequate housing, adequate food, transportation, things like that? And then we refer people to all of those community resources, because we know that if those life stressors aren't addressed, going to a therapist, and not having money to pay for that, or transportation, it's not going to be helpful. We also provide short-term support to people until they get connected. So we might check in on them weekly or every other week until they get, connected to those services. But what we are seeing is the same thing that Kira is talking about, are those basic needs. And we're also looking at what are the gaps for people in rural Portage County without transportation, without the ability to pay for a copay. These are the issues that we're looking at. And we also are looking at the gaps in our community as far as different members of our community. We look at Hmong members of our community are not being served in mental health. Why is that? So we're doing outreach. In January, we created a position as a bilingual Hmong mental health advocate who is now working in the Stevens Point School District 1 day a week, and then 4 days of the week doing outreach around Portage County. And what we're learning is that in working with our Hmong Uplift and Hmong Refugee Strengthening Program I have, is that there's not a lot of language in the Hmong language. They don't have words for mental health and self-care and things like that. So we're trying to get people who speak Hmong in the community talking about mental health, and how do these things translate, and how do we help educate people about mental health. So we started a support group, and we're working with some of the participants from some of those programs, and we're just trying to cultivate more conversation and outreach to get to those members of our population. Another thing that I can say, and I don't have the numbers in front of me, is we're not serving, the Hispanic members of our community. So we're looking at, just today, I reached out to Tri-County School District because they have a higher population of students, I think 29%, they told me today. And how can we do outreach to those families?
For the services that you offer, I'm trying to compare like those that are socioeconomically disadvantaged versus not that come to you. Is there a big disparity? Is it equal? Do you know?
I would say it's about equal.
Okay.
So with our program, there aren't any eligibility requirements other than you're struggling with a mental health issue. So we might work with people that would be eligible for services through Portage County Health and Human Services, but then we also are working with, people who work with the school district whose child is struggling and we don't know how to find a therapist that's within our insurance network. So it's really all the entire spectrum of people.
That's fantastic. It sounds like there's a need for, in light of the readings that you gave me, just culturally appropriate care for people. Right?
Absolutely.
To have staff members in your school district, in your county services, in your churches, things like that, that just actually have language skills.
Right, and that's a really good example I can give you is that, so we've worked with a few Hmong families, and the parents only speak Hmong. There's not a Hmong language provider in Portage County for therapy. They have to go to Wausau. So, we're looking at how do we bridge those gaps in fire services.
Is this a shortage in terms of like our public network or in our private healthcare facilities? Is it among
All.
All of them. Okay.
to my knowledge anyway.
It's incredibly surprising to me, considering we've had a little population here for 35 years.
Right.
A population that has been through trauma. I mean, their arrival was based on trauma, right? That's, wow. Does anybody have any questions for Trina?
If you mind.
Oh, yeah, please.
Number stories on folks with serious mental health issues. And I don't know which one of you would be most appropriate to answer this question, but some of the people that we've covered have all gone through the criminal justice system. These are individuals who they were asked for law enforcement to go do a welfare check, and during the course of that welfare check, the officer would call Green Bay Crisis and they were turned down for a referral. And there have been at least 2 cases in the past 18 months where individuals took their own lives, and in one case killed his father 24 hours after asking for help, even though he was denied a referral. Are your experience with Green Bay Crisis, are there other alternatives? Or any other comments on Green Bay Crisis or the system itself? Is it broken?
So Portage County contracts with Green Bay Crisis to provide 24/7 crisis line. We're part of the Northern Crisis Consortium, and that's who that group decides to contract with.
It's a decision. It's a regional decision.
It's part of a regional grant that we receive that helps to offset. We do still pay for a good portion of it, but it basically that grant can help offset crisis line costs.
Okay.
So with Green Bay Crisis, I can't give you specifics without knowing the exact cases that you're talking about, to know exactly where the system went wrong. The only thing I can say based on what you said is the emergency mental health system is set up in Wisconsin to protect a person's rights. We are a very strict state when it comes to emergency detentions. We will not detain someone and take their rights away unless they are an imminent threat to themselves or others. And so what that typically means is law enforcement will kind of do an initial screening themselves to see if they feel like it's appropriate to call Green Bay Crisis. They will call Green Bay Crisis. Green Bay Crisis will do the screen for us. If law enforcement, if they were to disagree with what Green Bay Crisis is saying, they can call to request one of our mobile workers. We have a mobile worker that's on call throughout the whole time to also then talk this case through and potentially have somebody come on site. Now, on-site response is only available up until midnight. After that, it's via phone. Just because these individuals are already working full-time jobs for the county and then just have on-call duties that go on for after hours. So I guess where I think is in the assessment process, I mean, if somebody doesn't meet criteria, then that's where it can get, if somebody's saying all the right things and willing to safety plan and contract for safety, that's where the state goes that way. People have the right to be mentally ill in the state of Wisconsin until they become a threat to themselves or others. That's imminent. That's the only thing I can really say without knowing more details. But there are a lot of people that do, like other states are not like that. One of our psychiatrists came to us from Florida. In Florida, you can detain, like as a psychiatrist, he could say he wanted anybody hospitalized. In his word, his clinical judgment was enough just to put somebody in the hospital. He moved here and it was a big learning curve to realize, like, no, you can't just do that in the state of Wisconsin. We also have a service facilitator that moved from Florida recently, and he very much, it's called the Baker Act in Florida. And so he's like, yeah, it's completely different up here. Like up here, we will not take away somebody's rights if they're willing to engage and work with us.
It used to be that way. The law enforcement officer who responded to the scene was able to make a determination if Joe was a danger.
Yeah, long time ago.
Is there any benefit to allowing an officer to make that call?
I wouldn't be able to say that. That was state legislature that made that decision, that mental health professionals are more apt to make that decision.
Thank you, Jess. Remind me not to ever slight our psychiatrists. Well, Disneyland. Holy cow.
Can I ask Trey,
Please.
question? Greg?
Yep.
Maybe Shirley, Jessica, are you seeing the same issues that these two individuals just talked about in terms of lack of affordable housing and transportation issues when it comes to the clientele that you're serving?
Absolutely.
Absolutely. Those are core issues in our community.
So we see all these nice apartment complexes going up and down here, right? We see all these nice apartment complexes going up. We need them, right? It makes our community better, right?
Yeah.
But our clients can't afford that. They can't afford the $1,500, $2,000 a month rental payment. They can't do that. Plus the utilities on top of that. They can't do that. For our clients, we do provide bus passes and gas vouchers for them to get to their appointments if necessary. So we do that. Now, as you all know, we're mainly funded by tax levy. We don't have unlimited funds to do that, so we have to be very careful of how we spend our money and how we do that. So some people aren't able to get the transportation they need because they live in Almond, they can't get on the city route bus to get to the therapist, right? And the gas vouchers are only good for a certain gas station that's not in Almond or Plainfield, and so there are gaps here that we definitely can address. But you know, the housing and when we talk about professionals, I mean, it's a systematic issue right now. We can't hire enough people. This field, I mean, our department, our agency has I don't know how many openings. It's a tough field. It's a lot. We can't get the professionals that we need to fill the roles that we need to help the populations out.
I believe you have 12 openings.
Stop counting.
Sorry,
I was brought on the HR committee and we're just flabbergasted every meeting how many openings there are in the council.
If affordable housing were available miraculously in our community, that would go a long way towards alleviating a lot of the stresses that you're describing across the board, whether it's mental health, AODA, child abuse, or is that what we're hearing from you, that is a key critical issue?
I would say it goes a little bit deeper in that, the people that we're working with, they're felons. They have prior evictions. So if it's HUD housing, they don't qualify for HUD housing. So it goes beyond just low. We do need more lower income, but we still are working with people who, even the few lower income properties that do open up, they're not eligible for those either. Because they're felons or they're registered sex offenders. And so that means that they are not available to them. So there is that part too.
Thank you.
So,
Thank you.
Sorry. In those circumstances, with a registered sex offender or a felon, are there any programs that are available to them? Or do they just have old-fashioned way of job?
Right. It's right now my staff, they just start doing Google searches looking for anything that they can that are willing to consider them for a place.
It used to be, I don't know, I think it's still Craigslist. You go on Craigslist and see the quote-unquote lower-income landlords that will take anybody that don't do a background check and will take cash.
I don't know if it's in the scope of any of your organizations, probably in the scope of ours, in the county, but have you had any talks with the organization, again, this may not be in your scope of conversations with the county, with inspectors, with landlord organizations to understand? I am a landlord, so I know a lot about this, but I'm curious if you've had conversations to understand why it's that way. And because I know there are some reasons, legitimate reasons, as to why it's that way. Pressure on landlords, etc. But is that in the scope of any of you? Is that something that you all do? You might not be. I'm just curious.
I think Mark Cordes would be a great person to bring in, which we'll bring him in at some point too, as Brent ready, but please.
From my perspective, Portage County, we used to, under my division, contract to have supported housing. And it used to be a situation where it was anybody that we were working with, there was 4 apartments and we could just plug whoever we needed that needed a place to stay in there. And it was more meant to be temporary until people got on their feet or whatever it might be. That also became under HUD housing rules as time went on. And so then it just was, we couldn't keep the apartment's full because people weren't eligible to go in there, so it was no longer cost efficient for us to have that contract. We've reached out to other individuals to see if they would be interested in doing something like that for us, but we have not found anybody who is willing to do that. That would be like a dream pie in the sky goal.
Is that what? If you had the resources, could you design housing that would meet the needs of your?
That would be beyond my decisional making capacity.
I'm kind of a pie in the sky, but it's not, because we're looking for initiatives that this committee can make a difference in our community. And so the input, what we're hearing today, I think is incredibly valuable. And when you're talking about housing,
When you talk about housing, it's so multi-layered, right? So like we talked about, if you don't have a house to live in, you're kind of what we call couch surfing, right? So you're not worried about going to a therapy appointment. You're not worried about getting a job. You're really not worried about doing the basic things. You're worried about where I'm going to sleep tonight. So if you have a house, a home where you can call, then you start worrying about those things, checking them off your list of going to your mental health appointment, looking for a job. Sometimes we have parents who don't have houses, who can't have their children because they can't have them because they don't have anywhere to have their children. So it's just a multi-layer effect of housing that is housing going to solve all their problems? No, right? Because they can have a house, but if they don't go to their mental health therapy or EODA therapy, or they don't go through their anger management, that doesn't solve all the problems. So house doesn't solve the problems, but it's a very good start. It's a huge obstacle that you can address, that can really start addressing some issues, because they're not worried about where I'm going to sleep tonight. I don't know where I'm going to sleep. We probably do that a lot. Like, I don't know where I'm going to sleep tonight. That's really sad.
Are there and I don't know, so my sister is substance abuse. She's from San Diego, and when she was arrested and she had to go somewhere and she had to get help, she went to a home, and it was funded by the state. She paid a nominal fee, whatever she could pay. Is there anything like that in the surrounding area?
That's residential treatment is very much usually like that.
Is it funded by the state?
It's Medicaid covers that treatment portion, remember. A lot of residential programs will have a step-down apartment housing option where they still start to live independently but still get the treatment services, but it helps kind of slowly progress people back into the community. Or there's also what's called sober living homes, so that could be what it is. Sober living, that is still a nominal fee because it's all those people sharing whatever that rent is for that home, right? There are a number of them in Portage County, but the last I heard, most were for men specifically. I know there was also one that recently closed its doors, but there are those available. But I don't know if there's anything available for women right now.
Oh, okay. Well, that's huge.
There's 2 men's in the area, and then there's 1 women's residence. Yeah.
Okay.
So it's called River Point. It's for a sober house, Oxford House, and then there's another one in Stevens Point, right downtown, and then there's one in Plover as well. And they hold about 8 people. And each person pays about $80 a week for rent. It includes everything in place and stuff like that.
I would love to get your somebody that when we talk about housing and homelessness.
I've lived in 3 different ones for about a total of 4 years.
Wow.
So then I was a president and mentor at them too. So
Well, we're gonna.
That's okay.
So, the mentor piece, do they need more mentors? I mean, what qualified? I'm just trying to think where we can plug in and help somewhere.
Yeah, we can discuss a lot of that and figure some stuff out. I know a lot of times they were just trying to approve for a grant to help out, because a lot of times there's cycles where the houses will stay full sometimes, and then sometimes they're down.
Okay.
And if you don't have everybody to pay rent, and rent's due, then you're getting behind with the landlord, So it's kind of a risk for the landlord, but fortunate enough to where, they've have just enough to stay afloat, I know the women's house was just, struggling a little bit, and they looked into a grant. I forget, they organized some kind of board thing. I don't know the details of it, but they're supposed to be getting a grant, because, they had to borrow $1,500 from the men's house to make their rent, so they didn't have to shut it down. So it's really, and they help out a lot. It's all voluntarily. Most people I went there after I went to treatment, been to treatment 4 different times. And this was somewhere to go to stay safe and sober and, go to lots of meetings and do lots of things. And then eventually, people do really good if they make it. I was thinking about all of this though, a lot of it's kind of like a complete circle. You guys see a lot of the people that, like you already brought up, don't have the housing, and you're struggling at home, and then you start using drugs and there goes the job, and then the kids are getting abused. And it's kind of a full circle thing, If you could come up with some kind of a housing that, you could, without violating anybody's rights, monitor, give them 6 months or a year at lower income, and you could monitor that they're not using, drugs or alcohol and stuff, and they're going to their outpatient meetings, and they're following all the stuff that they're supposed to, going to their mental health appointments, meeting with somebody, and going in a positive direction, and we can continue to help them. But then you run into, with the stuff that you said, that the felons and the sex offenders and stuff that, it's a huge, we have a lot of stuff that we need to funnel into, get to go in a positive direction, there's a lot of words.
Coming up on your point with the housing thing, I think one of the biggest issues is that from a landlord perspective is, I think there are landlords that want to be able to help out and can afford to help out and are actually looking for that to be, not every landlord needs to make a profit or a ton of money on every property they have. Some just have properties, and lots of people that have properties sitting around doing absolutely nothing, but there's a lot of rules and regulations and updates and everything like that. You run into a lot of regulations that make it cost ineffective. Then a landlord starts losing money, so it just doesn't make sense. And if they decide to update a property, then they can't afford rent. Now it has to be a premium rent. And so I think with the affordable housing, especially for situations like this, to help out people that are in a tough spot, especially with drug and alcohol abuse, there needs to be multiple people sitting at the table. One of my biggest things is I can't be a watchdog for a property for someone I know that there could be a potential, but if I knew that I could work with the police or a liaison at an organization like yours to say, call up Jerry or whatever, hey Jerry, we heard things are getting a little crazy over there. Can you, I want to call Miguel. I would be much more apt to work with somebody in that situation. Because I can't, because if I go there, all of a sudden it becomes an issue of potentially for discrimination. So then they just decide not to do that. Update the house and charge a lot of money for it. But there are options for that. But you have to, those people need to be brought to the table. And I know, especially in Point, and I come from Wausau, there's the slumlord stigma. Nobody wants to bring them to the table, but they are also your solution. So I think this is it's good to hear that this is not good to hear, but I'm glad that that's a trend across the entire city that needs a solution. That can be worked on. I think there are solutions for this.
One more from Nakira, and then before we go, we got to kind of backtrack out of housing, because I want to get Michael Clemens to speak too. So Nakira, please, what do you got for us?
Just one thing along with what you're talking about. If you thought about if every large apartment building in the county had one apartment that was specifically for a person low income qualified for it, but not necessarily HUD funding, because we know that excludes people. Like that would go such a long ways in addressing this problem. Like we don't want to see just low income housing buildings, right? That's not inclusive housing, it's not integrated housing. That's saying you're all poor, you're all gonna live here. No, like how do you encourage people to see how people who are thriving are living. If you are saying you all have mental health, you're all on MA, you all get Social Security, you all have to live here because that's all we can afford for you and that's where we want you to be. So if it were something that's integrated and if all landlords could step up, I understand there's a risk, but the risk is lower if it's saying I'm giving up one apartment here to be a lower income apartment. And looking at like legal side, like we talk about all the new apartments that are going up. I'm on city council. I'm obviously a part of those decisions, but we can't tell developers you have to have some low income units in here because of Wisconsin laws. So I would love to be a part of that solution too, but that I don't know. Is there a way that we could make some kind of partnership that invites landlords to be a part of that discussion?
We can definitely talk about it. Brown County did just that. It's in the agenda in Troy's part of the EI conference, but they had a nice development which showed integrated socioeconomic integration within this choice they take upon. Before we get too far down that road, I'd like to welcome Michael Clements. He's our Veteran Services Officer. So all things veterans.
Pretty much. If it's got a veteran attached to it or a dependent, I'm probably involved. I guess I would preface everything with, in county government, veteran services is a pretty unique animal. And you can see it in Chapter 45, which is my governing guidance, where Chapter 45 of the state statutes talks about the veteran services is to be unique and distinct from any other county department. And I think probably why that is to shield me from politics. I believe that's why they wrote it.
Amen.
Yeah, I don't want to be a political animal. Okay. I think I don't have huge data sets for you. I have a number for you, but the things that I frankly don't know any county veteran service office in the state that keeps track by minority status of who they serve. We're kind of not focused that way. We have a saying in the military, everybody's green. So that's how I look at people. You're green. You're either green or you're not. And by green, I mean when you're in the military, you wear green. So I would also say that the military was an integrated organization before society as a whole was ever integrated or ready to be integrated. So that's the perspective that we as military people come from. I'm a 20-year guy. My assistant's a retired Marine as well. So that's the perspective we come from. If you're green, we're here for you. Or whether you're a dependent of a green person. There's about a little over 4,500 veterans in Portage County. There are statistics based upon on the federal side of the house. The things that I do and my grant reporting does not require me to keep statistical data on ethnicity of clients I serve. That's kind of not how we operate. If you're a veteran, you get help. And to speak to, and some of the handouts that I gave you, I'll talk a little bit further. But I want to explain to you how I interact with the community, kind of what I do that you may not be aware of. During my tenure as County Veteran Service Officer, we created a police liaison for all law enforcement in the county. So the PD, Clover, and the sheriff have a designated liaison for veterans. It's not unusual for me to get a call when I'm off duty from a liaison officer with an issue with a veteran. With regard to transportation to the population that I serve, during my tenure, we created what's arguably the best transportation gold standard in the state to get veterans to their medical appointments. And by that I mean it's a one-call stop through central transportation. Veteran calls, says, I gotta be in VA Madison next week. It's done. And I actually had a couple of DOT engineers tell me that, so that's where I come from. So we have a good infrastructure, transportation, to get veterans where they need to be, if it's at a VA facility. We have veterans liaison officers in law enforcement. I interact with Aging Disability Resource Center. You could view a lot of what I do as a cost shifting from the county to either a state or federal entity. So I'm saving taxpayers money by doing the referrals and the things that I do. It's kind of a cost shifting to either state or federal. We'll get into that a little bit later. I conduct outreach, and outreach is an ongoing thing. It never ends. You know, to create awareness in the public of the services that are available to them. I guess I would say that if you get a veteran to me, I don't lose veterans. So if I get in contact with them, they're going to be helped, and they're going to be where they need to be. Whether it's AODA, mental health, homelessness, or whatever. I have a lot of resources at my disposal to take care of all these issues, no matter what they need, whether it's financial or whatever. I interact a lot with state and federal agencies. On the state, it's the Wisconsin Department of Veterans Affairs, and on the federal, it's the federal U.S. Department of Veterans Affairs. Part of my duties is I'm an accredited national rep through the Office of General Counsel of the VA in D.C. to do what I do. That basically gives me legal standing in the VA's claims world to represent veterans. I do disability claims for them. I do pension claims. I do all that kind of stuff. And I'm basically the power of attorney for the veteran or dependent when we do these actions. So it may be disability compensation, it might be non-service connected pensions, it might be enrollment in healthcare, it might be a survivor's pension for a surviving spouse of a veteran that died of a service-connected condition. So it's really wide-reaching. And it has a big monetary impact on the company as well. And over $20 million in disability per year coming in. So I guess if you look on a return on investment thing, I think my budget's about $209,000. So I'm bringing over, $20 grand or $20 million a year. And that money's spent here for the most part, because that money's going directly into veteran accounts, and they're spending it here. Housing. There's a handout that I gave you. It's called VORP. That's an acronym for Veterans Outreach Recovery Program. We're in Region 7, and the rep is located in Appleton. However, if I have a housing or an AODA issue or whatever, that person is probably there next day or the day after. I interact a lot with the Hope Center on homeless veterans. They come over and see me, or I do outreach at the Hope Center. We have gatherings to do that, where I do outreach to homeless veterans. If we have this VORP program is really kind of nice, because even though the person may have been, like just say I don't want to say only, but let's say the person didn't have active duty, what we consider to be active duty, which makes them a veteran. Let's say they were National Guard or Reserve, we can get them AODA treatment through the state, through the VORP program. And we can get them the mental health they need, even though they're guardsmen or reservists. Whereas the federal VA wouldn't accept that person because they want eligibility as a federal veteran. So basically, what makes a veteran is active duty. So like active duty for training 2 weeks during the year, boot camp, like that. That's active duty for training. That's not active duty. So when you see these reserve and guards personnel, when they get activated on Title 10 orders by the president, that makes them veterans. Up until that point, they're not veterans. Because they've done 1 week in a month, 2 weeks during the year in boot camp. So that's what makes the veterans active duty. And those are the veterans that the federal VA serves. I get calls from family members who their family members are struggling, and I meet with their family members and get them into the appropriate lane where they need to be. If it's a matter of filing a Social Security disability claim, that's kind of not my lane, so I refer them to ADRC for their experts to help them file their Social Security disability claims. I'm kind of the VA guy, that's my lane. Although I interact with all these different agencies and entities. I don't think there's plenty of services out there. If you look at your handout, the federal VA is actually pretty leading, and we're talking the LGBTQ+. If you take a look at this handout, the federal VA is really kind of progressive with this, maybe more so than other agencies. And it's pretty extensive if you look at this handout I gave you, each of the services that are provided. There is, in my last training session for this year, I gotta do CEUs every year to maintain my accreditation. But if you look on the first page of that VA handout I gave you, there's a dedicated individual at the Tacoma VA, which is, for lack of a better term, the mothership of all the clinics in our area. They control the clinics. So you have a coordinator. We had this person come speak to us for about an hour and a half in my last training session. So that's the point of contact. If we have those kind of issues that needs to be addressed, I got a go-to person there. And frankly, throughout the years, this is not a new issue. I've dealt with everybody. So it's, again, to me, they're green. Okay? So that is really not a new issue to me, and I don't see a lot of people out with it. They come in, they need help, they go where they gotta go. No matter what the issue is. I have a mandated by Chapter 45, I have a Veterans Relief Fund that's tax levy funded partially to provide economic assistance to veterans who are experiencing economic hardship. That fund is overseen by 3 commissioners appointed by the county executive, and that commission is known as the Veterans Service Commission. So when a veteran comes to me needing economic assistance in an economic crisis, loss of job, death, whatever the issue may be, then that person applies for the Veterans Relief Fund. I, in turn, have a discussion with the commission members, and they up or down vote on approval for whether it's rent. I interact with Operation Bootstrap. I do referrals if they need food. I go to them a lot if it's just a food issue. But if it's like rent, stuff like that, the Veterans Relief Fund is there for that purpose. So the Veterans Relief Fund is funded not only from the county tax levy at the rate of $4,000 a year, but I also have private entities that donate to it. So I'm kind of happy that I haven't had to go to the county since 2004 for more money. So my private donations have really come through. So that, in fact, that $4,000 figure, if you look at it, we got 4,500 vets in the county. That doesn't go very far. So my private funding sources and their donations have really come through. Annual car shows, stuff like that. So that's worked real well. So I had resources on the federal side too for homeless issues, and it's called VA HUD VASH. And coordinators and social workers are located out of the VA Toma. And they do a lot of Section 8 housing, and they help veterans who are homeless or about to be homeless with those housing issues. So I got either the state I can go to with housing, alcohol issues, mental health, or I can go to the feds. There's residential treatment programs for both entities, state and federal, that I can go to. The inpatient is normally done at the Toma VA Medical Center, which is the main hospital that controls the clinics. We have 2 clinics closest to Portage County. One, they're outpatient clinics. One is in Wausau, one is in Wisconsin Rapids. And these are what we call, the acronym is CBOC, Community-Based Outpatient Clinics. Prior to coming to the county, I was a federal contracting officer for the VA. And I guess during the late 90s, I put a bunch of these clinics in place in UP and Michigan and throughout Wisconsin. And so I'm kind of proud of that, actually. So we literally brought healthcare out to the rural veteran, where previously they had to go to Madison, Milwaukee, or Toma to get treatment. So that all these services came out to the rural veteran. And that includes mental health treatment, counseling, primary care, vision, audiology, and physical therapy like in Wausau. Wausau just opened up a huge clinic, about 40,000 square feet in the old Chaco thing. It's beautiful. I've been there. It's beautiful. Been open maybe 4 or 5 months. But that's really brought a lot of services to veterans in our area. Does anybody have any questions?
Thank you for your service.
It's gratitude.
Thank you.
Please, Mr. Sawyer.
So the 4,000 that the county gives you, and then the money coming in from private donation, would you say that that is from the years of networking that you and your office have done here throughout the county, making sure that our veterans are taken care of? You know, because I've been in your office, I've utilized your office, and I just want to highlight that networking and that ground building truly is sometimes the answer. So can you elaborate a little bit on your networking? And if not, that's fine, but I just find it amazing that in 18 years you haven't had to go back and ask for more money into that part of your budget.
I'm not your typical bureaucrat, even though I've worked for the government since I've been 18. I try to be good steward of taxpayer money. And so that's what I did, is I outreached, there's a car show down in Bancroft that goes every year, and I have other donations come from private sources, so when I get them, I just take them over to the treasurer, get them deposited. So it is a network thing. And I actually, what I did was, because I didn't want to lose these funds to another county department, which normally happens if you don't spend your money, I created a non-lapsing fund for this to roll it over into the same fund for the next year, so those funds didn't get sent to the general fund, and they could be used for that purpose. I guess what's really, what I like about this fund is, unlike, let's say, if you're going to donate to a national organization, you don't know what their administrative fees are and where that money's really going. Whereas if you donate to the Veterans Relief Fund, 100% of it goes right to the veteran. There's no administrative fee, because the county already pays my salary. So everything is 100% going to the veteran. And the whole network thing is huge. And that's where all these donations come in from, is just being out there and talking to people. And
that out of the box thinking like that is crucial and valuable and it's paid off. So thank you and your office and your staff throughout the years for that hard work.
Thank you.
Thank you, Michael. Does anybody from the committee have any questions for Michael in regards to what he said and the services provided for mental health issues for veterans?
Oh, one last thing, sir. I'm on the suicide review team on the county too. So we've had a couple of veteran suicides. So we meet and discuss that on what we can do better. You know, when we're talking about veteran suicide, so I'm on that team as well, and we review all that. And I think that's a very helpful thing, that we look at what we're doing. Can we do it better? Can I do things better on outreaching to these veterans in crisis? So I think that's a good thing, that suicide review team is, yeah.
Do we have data for suicide numbers in Portage County?
Who's the what's her name, the RN that runs Lynn Frost.
Right. That's the suicide death review, and our average is 10 a year. I'm not sure where we're at right now for the year. I think it might be 6 or 7, but it's usually about 10.
And comparatively in neighboring counties, do we know if that is?
I don't have the count. We can get that, but yeah, we average 10 a year.
Was that for veterans or just altogether?
Total.
I think probably 2 of those were veterans.
From this year, yes. I do the suicide response. So when there's a suicide in Portage County, I reach out to family members after to provide resources and let them process that. So, yeah.
Thanks for clarifying, Michael, on the team for that too. That was going to be my question: is what gap do you see in veteran services? Is there anything that this committee can help with or work towards on a state or federal level? Because we can make suggestions.
I mean, outreach is an ongoing thing, and it's been since day one I started. You probably never have enough outreach. That's maybe the gap. There's not a funding gap, there's not a resource gap, because if I connect with a veteran, they're taken care of. You know, they don't slip through the cracks. If I engage them, they're where they need to be, and I get them where they need to be. Unless they choose to not want to participate. It's not a funding gap. I don't see a funding gap, because there's enough funding for me to do what I need to do. It's just a constant outreach and awareness to the community of what's available. Like, you know, if you want to call it a gap, I would say that's the thing.
So to get people to reach out and ask for that help too, you know.
As men, right?
Yeah.
We think about a majority of the veterans that we are talking about here, a large percentage of them are men versus women. I think, well, we have to do them as men. So, Michael, I appreciate the very frank discussion we had over the phone before we came here, and I saw you brought some information about LGBTQ plus veteran care, and I'm just curious about your opinion of how has the culture changed in the military since they got rid of the don't ask, don't tell? I mean, I'm realizing this tells me a ton, right? Like they're actually giving services to this community of people. But in your opinion, like what did you experience?
So military culture, the new ones out coming out, I'm seeing, I guess, more acceptance, more awareness. There's not the discrimination that there was before, so that's not tolerated in the ranks. You know, it's a little beyond don't ask, don't tell. You know, it's the whole culture has changed a lot. Like, you can't even raise your voice much anymore in the military because it's considered hazing. Now, I come from a culture of a lot.
You were a few years back, weren't you?
I'm former Marine. I served in the Army and I retired Navy. So my culture is a lot of yelling. So you can't do that.
Amish, why are you yelling now?
Maybe it's not yelling, it's called a command presence. Yeah. So it's all about assigning the right definition to the tone.
Gotcha. Thank you.
That's all I could stand.
Does anybody have any other questions for Michael specifically? Okay. So we had a lot of important discussion happen here, and I hope this is partially what the committee was asking for. I'm doing my best to herd cats. I asked, so let me tell you, I asked 4 people to show up, and I got 5. I don't know how it happened. I didn't expect that to happen, but I reached out to everybody, and I expected, not as many folks to be a part of it, but they all said yes. And then I got McEwen right at the end here. So I appreciate your perspective, because Rec is part of the organizational level that you're at, for the community as well. Is anybody in the gallery have anything to say? I see we have Mr. Kapelski and 2 members of the community and Supervisor Soik. Does anybody have any questions or comments or any recommendations? Thanks for being here. I appreciate you all coming to be part of that.
Yeah, I have a comment. I think our county is incredibly lucky to have the 5 of you in leadership positions that you're in. And I hope you all feel very appreciated. You have tough jobs. But you make me proud to be part of Portage County. So thanks for what you do.
Any last questions? Okay. We will move on to item number 9. You can feel free to stay and listen to our discussion on possible goals for this committee, but it is 6:15. I know I'm hungry, so I can.
Thank you.
Thank you for being here.
Thank you. Thank you.
Thank you all.
All right, so we have item number 9 here, discussing possible action, diversity inclusion committee goal setting. So I kind of look at this as, we can start generating a list and build on that list. Now, moving forward. I did put a couple of things in the agenda. I put the life report in here from 2017, so it's a little dated, and it's coming out again. And they talk about their calls to action for Portage County. And then I also put in page 15 of the DEI workshop that we attended for WCA, and it was the things to talk about. And I thought these were really good questions just to kind of get us thinking about what our goals could be and how we want to address them. And we did a lot of that work here today already, just asking tough questions to our panel and getting good answers. So, where do folks want to start?
So I think we need to put a stake in the ground because, right, we've already been to 3 meetings. I feel like we do a lot of talking and ready to get some work done. So I feel like if, as part of goal setting, we can be comfortable to say, based on what we've heard, so we've heard mental health is a big issue, we've heard substance abuse, lack of housing, like, if we just start there and then work as a committee toward driving some action, I just think we need to start working. And so I don't know if you guys feel strongly about anything, but if we start with the topic, then I think we can drive the actions from there.
I know we talk a lot about mental health and drug use, and when I first came on, this one of the things that I had on my agenda was housing. And after hearing everybody across the board talk about that, and it is close to, you know, what I'm involved with in my professional life as well. I think that for me, after all of this, I think that is a really good place to start. All of these other things surround the housing issue as well, drug abuse and mental health issues. You don't have housing, basic necessity, everything else can fail. And I also know that this is a massive topic throughout the entire county, throughout the entire city, throughout the entire nation right now. So there's not a lack of people and professionals and expertise and landlords and everybody in the world to contact to get all the data in the world, all of everything we could possibly need. Because it is a solution, and I can tell you it's only going to get worse. There doesn't seem to be any sign of that changing anytime ever. So it is something that needs to get addressed because it's going to be extremely problematic in the next couple of years if we don't find some sort of a solution. It's going to take a lot of people, not just our community, but I think, and I don't know where anybody stands on that, but I think there's a lot of resources in this town, and it's very much top of mind for, at least for city council, for Stevens Point. Lots of developments in town, lots of discussion. So this is a good time to discuss a lot of that right now. Because it's the top of mind of everybody. That's my 2 cents. If we're looking for a singular thing.
Well, just to start, and I think just to start moving, and then we can pivot, but like to like Dustin, what you talked about, those homes, right? Like they don't have continued funding. So like how can we help there so that they can stay open? I don't know. I mean, you have a lens that we don't have there, so like I'm trying, like, is there something we can do there? Just
I have experience living in it and all that. I'm just now starting to get into the legalities of nonprofits and where you can get money from and stuff like that, with being in Oxford House and sober houses and stuff like that. They can get donations. You know, people can give donations and stuff, but it's not county ran, it's not federally ran, it's not state ran. It's just a bunch of addicts that moved into a house and started paying their own rent, paying their utilities and stuff like that. So it's not connected to any legal trouble or anything like that, which is really cool. You know, it's just, you gotta wanna be there, and that's what makes it work, you know. But there is also people living there that are in drug court and have a lot of legal issues too. I have in the past seen a lot of people that are at, but it's not county ran per se.
But because of that comes with some bureaucratic hoops as well. Like you're saying, the legal trouble is, you know, there's a benefit to being part of the county, but there's also benefit to being outside of the county sphere too, because we have to follow state rules and regulations and things like that. Whereas if you're privately funded, you have greater flexibility to maybe think outside the box.
And, you know, then that was a big thing of, you know, getting it passed to be able to have one in the city. You know, people sometimes are like, well, I don't want to pay for that. I don't plan I pay for a bunch of addicts, you know, or can go get a job and pay for it themselves. You know, that's one of the benefits is, you know, they're all self-supporting. But I mean, there's been people that have done donations. I mean, that's helped a lot.
And you're referring donations to help keep, to run operations.
Yes, to keep the house afloat, because there's times like when the pandemic started, you know, when the treatment center here in town went down to, they could only have 4 people at a time. I don't know if that's the exact number, I can't remember what it was, but it was, the capacity was cut in half. You know, that's where a lot of the people come into the sober houses is from other counties as well, into the house, and a lot of the numbers drop, so it's harder for them to stay afloat.
And some of these, as I'm just thinking, as we're talking here, I mean, those are like more nonprofit. Is that what you're talking about? These are like not-for-profit. I mean, I come from a for-profit area, and I'm thinking about this. There are lots of opportunities to create these types of houses for a small profit or rate, at least for a break-even purpose. I mean, there are benefits to even breaking even when you're a landlord. So for a committee like this, if we see this as something to focus on, bringing in the stakeholders or the city and the county government and bringing in taxpayers and everything like that to understand the benefits of why would we want this? Because we're able to help them, not be the problem in the community that they currently are, that you currently think they are. And it can still be a private enterprise, you can still make a profit. The city and the county can help out on some level with grants because it is serving the community. I mean, there's a lot of options as I'm thinking about this where we could, we have to bring something to the county. This is something we can bring, and it's an ask as well.
You're totally spot on, because I'm thinking about like mixed economic development, right? Mixed income development, like they're doing in Green Bay. Well, what is that doing? It's benefiting the people of Green Bay. That's the city folks, right? And but what is it also doing? It's limiting the amount of resources being spent by county services, right? So there's this like, you're right with each other. If you're providing someone with housing, you're getting them out of homelessness or out of poverty one little step at a time. You're alleviating the burden out of the county. People are getting residency, they're getting jobs, they're actually contributing back to the tax base again. And we have this win-win, right? It's kind of pie in the sky stuff, but those are the kind of things we need to leverage in our position, is to ask our county executive, ask our mayor and our city council to say, hey, let's start playing nice and work together on some of these little projects, because we got a lot of big projects that we're going to need to have these relationships for in the future. So I think it's something really we could do. It's just a matter of, with city county government always going around that we need to get rid of so we can do the good work.
Is there a landlords association
There
in
is.
the county?
I just got on board.
It's what?
I did, in the Central Wisconsin part. I just got on board last week.
And how large is it?
I don't know all the details.
You
I'll
don't
probably
know.
know all that very
Okay.
soon though.
Okay, I'd like us to look beyond county, city, state, and involve the private community. Even exploring this, because this is key. We don't have enough people living in Portage County to fill jobs. We want to make this a community where people can afford to come and live. And affordable housing has got to be a huge issue when it comes to the recruitment. I think it's a community issue. It's not just a governmental issue. And I'm wondering if we could start with some of these private, this group that you just got on the board with.
To discuss possibilities. Yeah.
And talk more with them about this issue and to learn from them about it.
Right.
Just a thought.
In this situation, it's one of those where the cart and horse have to come at the same time. What I mean by that is the landlords butt heads with everybody in the city that regulates landlord, shall we say. And so the reality is they need to be able to work together and understand that landlords are capitalists that have to make money. That's not going to ever change. And the city has to look out for its properties and make sure that no one's taking advantage and having derelict properties instead and the other. They need to come together to start without fighting and just accept each other for who they are and figure out, okay, you think this way, we think this way, but we need this common goal. You need me and I need you. How do we come together? And they just need somebody to say that in a group setting.
Some of the major employers should be present for that discussion too. Ones that are constantly advertising for job openings for people and are unable to fill them. Like Portage County. Yeah.
So I like this idea. So I think that might be a good place to start. I think maybe perhaps we start our goal low-hanging fruit and longer strategic objective, right? So that longer one, I like what Makira said about can we build partnerships with apartment building owners to at least have 1 to 2 low income. I mean, that might be something for us to look at as a committee, like to put all our minds together and resources to see like what types of conversations we need to have to get there. I also think that this committee could to something that's more low hanging fruit. And I heard a lot of organizations today that I didn't even know, I wasn't aware of, including the homes that you talked about. And so I'm just throwing ideas out there, you guys. But like, wouldn't it be nice, because you talk about also like inclusion and bringing people together and finding common ground for the greater good. Like we could create, and I don't know what it is, if it's a web page or if it's a Facebook page that spotlights monthly organizations just for information sharing and awareness. Because to a lot of the speakers' points, like people don't know what's available, right? There's a stigma also. So if we're talking about it, that's information sharing, that's awareness. I also think we should have an ability for community members to donate if they so choose so we're sharing with the community, we're informing them, we're creating awareness, we're creating community, a sense of community, and we're creating an opportunity for these organizations to get additional funding that's outside of what they may get on a yearly basis for their budget. And I'd be happy to lead that.
I'd like to know more about the housing market in our county. Like we learned today, these people come and it's like, wow. I don't know about the rest of you, but I learned a lot.
Yeah.
And I would like to be able, if we take this on as one of our goals, then I'd like to learn more about the actual housing market, what it looks like, what the trends have been. And I'm with you in that action, but
Educational.
I need to understand more about from a landlord perspective, from all of this.
So I think that's the longer term one, if this committee agrees to it, and maybe perhaps like work that we could just get started to help inform about organizations and opportunities and support is something like either creating a committee website or Facebook page, or probably Facebook, but I don't know how many people go to websites. I don't scroll websites at night, but just so we can get things going. I don't know, so we kind of have like a low hanging fruit, short term action oriented goal. And then we have this longer term one to learn more and really that this is like, if we could chip away at this, that would be huge for this committee.
I see that as a goal, right? Like housing is a topic. Mental health is a topic. AODA is a topic. Homelessness, policing and justice, all these things, which I intend to have each month to have an in-depth topic in addition to our action items. So I really like the idea because I was thinking about some sort of outreach Facebook page too. Like an outreach and Facebook page too, in terms of like what we're doing as a committee. But we don't have that in any other aspect of our government. There's like a Health and Human Services page which gives updates on get your vaccine, or check this out, or here's this service and things like that. But we don't have like a finance committee Facebook page.
Well, then we're the leaders, right? And
the public library has one. Solid Waste has one.
Well, they do, but they also have a staff person, a paid staff person, and a budget.
Yeah.
We have zero budget.
And I'm willing to take that on.
That's not a role that we can take on as committee members. The staff has to take those roles on because they're staff. That's their job. Right. But we also.
I'm not on the screen. Except I will volunteer to investigate this part, but if there's a way to create a Facebook page or a new account, it can fall under the county umbrella, and IT will make it for that department. The thing is, we don't have a department. We have the executive office, so this is under the executive office, so we probably fall under that. And I know that if a person is not technologically savvy, if they want to submit stuff to the website, I don't know if anybody looks at our county website that much, but great. Yeah, like that's an issue. But if you want something put on the Facebook page, it can be submitted to IT. They will make sure that it's allowed and they will post it for you, so you don't have to be. But again, it's the legalities and everything as far as like a supervisor, and you know about that.
I think we just need to dig into it. I can't caution your idea. I think it's great. It's just like, can we do it? Is the other thing. You know, you can have a school board Jennifer Bushman page. I can have a supervisor Vincent Wilson page. We can do our own things. It's whether or not we can have, you know, like what I'm hearing, long game would be like, hey, Mr. Pavelski, I wish we could have a staff person dedicated to this work, right? So can I put that request in? And did I just see an ask of 2 lines to it? I know. And that's where this is the hard part. It's like we can't even get another sheriff. Like we can't get another health and human services person because we can't afford it or we can't find a person. Can we hire like school district? Can we hire a person who's focused just on DEI work?
So we need to find out how much of this we can do ourselves.
Right, that's what-
and then figure out if there's a workaround or if there's a way with existing resources to get it done.
Again, like I hate to be, I am not this guy, I'm not the bureaucrat, but we can't, like, that's staff's job. Like, if I was, you know, I could do this work all day long, you know, but I have to have a job to feed my family. We, like every other department, you know, solid waste as a staff person who's also balancing their budget and also doing the work of solid waste, but then also has outreach through educational components and Facebook and whatever. So that's the hard part about this is who does this work full time.
Well, wait, I'm just gonna do I mean, because I like heard everything tonight, and I want these organizations to be like, I want to inform the community. I know people would be willing to like support and donate and volunteer, and like if we could, so we can find out that workaround or figure it out. But like have a calendar to say we are spotlighting this organization this month, and so it might be the Sober Living House, you know, houses for the month, and like I envision like interviewing people because people get engaged that way. Like, tell me, Dustin, about your experience and how did. And it's not you, but like, you know, but like, I'm like bringing like Makira in and like having her talk about like how I just feel like there's an opportunity for us to like marry all of these needs together, and it would help with like the goals that we have, like awareness, support.
That's what I want to do is, like you asked last time, we need to make some goals. So these are examples. Like, should our goal be to look at mental health deeper, find those connections, make sure we're not duplicating efforts, right? Because we have a lot of mental health professionals in our community that are doing the work, and we're just kind of being the hub of the wheel, correct? We have affordable housing. We are going to handle this. This is the one I want to put on the next committee agenda, right? We are going to tackle some housing stuff. You know what? There's also a housing authority. I talked to Bobby Gifford. He's starting a housing task force. Like he's trying to get that started with folks from the university and from the community. So he did that because he heard I had a conversation with Mahjong, who's part of WEDA, WHEDA, housing and economic development. So I've been talking with her. I'm going to bring her here to talk about what she's doing at a regional level. So it's like
The city has a housing task force too.
City has a housing task force. So in the spirit of not wanting to like duplicate efforts, we're kind of doing a resource inventory right now. And I am with you 100%, Jennifer. I want to take action, but as we'll learn, government is unfortunately too slow. Right? Mr. Pavelski and I this is something we very much agree on. We have to follow the process. And
that's fine. The last thing I would want is for us to spend half a year meeting and still not having accomplished anything.
Well, you know, half a year is only 6 meetings.
Right.
Right. So that's not very much to get your feet under yourselves when nobody in the committee even knows what's available to us. So my goal is, let's develop our foundation. This is just my opinion, and I will go with the direction of the committee, is let's develop a strong foundation, make educated goals, and we can start that list tonight. We don't have to finish it tonight, but we can start it and keep adding these goals and even each month, we go, okay, we did 3 goals last month. How does that sound? Nope, we're gonna fix that. Yep, like that one here, let's add a 4th. Every month we do that, and then we use those goals to define our charter, right, our ordinance. And we treat that ordinance, because it's murky at best, right? The ordinance is.
Well, we are honing in on.
Right, I feel like we keep
We are
it
honing in
here.
on items, and we've got 3 solid things so far that we all seem to be agreeing on. I mean, I would propose like the next meeting, and once we figure out what we can and can't do on the Facebook side of things, that's not gonna get solved today, but that we bring in some of the housing people. And I'll have plenty of questions and comments and stuff for them.
So send me your information about housing context, how we work on that as well. Please give me a little flexibility with that, because I had to pivot on some of this stuff just because of availability of certain folks, like Tiffany, thank you. Tiffany couldn't make it, so and I really want her part of the conversation. So that's when I you told me that, and I was like, okay, housing's off, let's focus on justice. So, housing will be the goal, and then if, some month, any weird reason, like someone can't come and talk to us about economic development, we're gonna pivot to policing and something else, I can get those people instead. But the goal is just education and then have action items for us as well. So of course, you can all send me stuff, and we'll keep it in the relevant topic. So we're not talking about housing and policing, in the same night, so it makes sense.
So I'm still unclear on what we are focusing on. So you mentioned policing. So are we just hitting all topics?
So, well, for goals, I just wrote down stream of consciousness what's on my mind of topics I'd like to discuss. Goals and stuff, we have these examples from the life report, and then things to talk about from the DEI conversation, which was within your county, what are the health outcomes of different populations within your community? That's something we can talk about with just about everything on each topic each month. What programs can the county implement to help offset disproportionate representation to help address social and economic inequalities? Inequities. So we can talk about that in everything again: mental health, housing, homelessness, policing justice, school and education, economic development. Those are just some, like a framework.
Yeah, it's a framework to look at.
Yeah, and those goals in this framework, I figured that is what we should hone. So we're asking a similar set of questions each month to each different kind of group. That's just a suggestion